A kidney transplant has many advantages over dialysis. After a transplant, you will have better kidney function, which improves the health of your heart and bones. Some transplant patients say they have more energy, breathe easier, and have much less swelling. Plus, you have more time to do what is important to you instead of spending time on dialysis treatments. You do not always have to be on dialysis to receive a kidney transplant. When your kidney function drops to less than 15%, or your kidney team thinks you are within 6 months of starting dialysis, you can be activated on the transplant waiting list, assuming you've had all the tests needed. In general, patients who receive a kidney transplant live longer than if they had stayed on dialysis. This is true even for people who have diabetes, obesity, HIV, or old kidney transplants which have now failed. Some people also think they're too old to get a transplant, and that's not necessarily true. The only way to know if you would be a good candidate is to ask your kidney doctor. If you are a transplant candidate, you will be sent an appointment in the Transplant Assessment Clinic. There, the medical team does tests to make sure you're healthy enough to undergo surgery and that a transplant would be in your best interests. There are potential risks with any transplant. These include the usual risks of surgery, including healing, bleeding, infection. But there are also other risks, such as the small risk of certain infections or cancers from the medicines you'll take to keep your immune system from attacking your new kidney. Some patients find the thought of a transplant overwhelming. However, your Royal Free Transplant team will help you learn how to care for your transplant. You will need to come to the transplant clinic at the Royal Free twice a week for 2 months. This will reduce to weekly in month 3. Your recovery after transplant is very variable, and many will take 2 to 3 months before you feel able to return to work. There are 2 main ways that people receive a kidney transplant. Thousands of patients each year receive a kidney transplant from a living person who donates a kidney. Others receive a kidney from someone who has died. These are called deceased kidney donors. We are now going to talk about both of these options for you.